Good morning everyone, I am Francesco Martinetti from the Gioia Martinetti Dental Clinic in Moncalieri in the province of Turin. And I'm pleased to share with you the case of Isabella, who came to our clinic where we specialize in orthodontics, specifically in adult teeth alignment. Her main concern was whether at her age, around 40, she was still in time to straighten her teeth. The answer was definitely yes. Teeth can be aligned at any age, provided two conditions are met. The first condition is that there are no infectious processes affecting the teeth, meaning no cavities or holes in the teeth. The second thing is that there shouldn't be any chronic inflammation of the gums. So bleeding gums are not good, nor is periodontitis or pyorrhea. These issues need to be kept under control, so we first have to make an accurate diagnosis. In her case, we treated the small cavities she had and the gum inflammation, and after that we got started, and you can see the results we achieved. These are the intraoral photos. Above is the before, below is the after, and we have aligned and recentered the teeth. We did this with transparent aligners on both the upper and lower arches. The smile has improved not only intraorally but also extraorally. From a very narrow and contracted arch, we added volume, widened the arch, always within limits, and you can see the transformation of the smile before and after in just 20 months. Intraorally, we talked about the smile and aesthetics. But orthodontic treatment is not just about aesthetics. We also work on the way the teeth come together, that is, on the bite. As you can see, at first there is one of the arches that is very crowded. There is a canine on the lower left that is completely out of place and down, and gradually everything is brought into a symmetrical closure. The goal is to align and symmetrize the way the teeth come together. Also from the side, you can see how the teeth are all closing outward. They need to be properly brought back inside their own bony envelopes. Occlusal photos from above and below, you can see how the teeth are very crowded and the upper lateral incisors are protruding and very small. So we need to restore the arch shape, enlarging it to the correct anatomical form. And then we need to enlarge the upper lateral incisors. All of this is also done using measurements. As you can see, we measure by how many tenths of a millimeter the teeth need to be moved within the bony bases. And from the panoramic X-ray, you can see that the patient still has some root canal treatments and crowns. These teeth can still be moved, so there are no limitations. Simulation. At the beginning, a complete diagnosis and simulation of the dental movements is also performed. This is also to determine how many aligners and dental trays need to be produced for both the upper and lower arches, as you can see. These simulations must be highly predictable compared to reality. And in this case, the doctor specialized in orthodontics will prescribe them for the lower arch. Also, as you can see, the lower teeth are very crowded and difficult to keep clean. Proper alignment also allows for more effective and thorough brushing. And as a direct result, this contributes to a significantly better overall health condition of the gums and surrounding oral tissues. This is the before and after. Before, you can see the crowded teeth you see. The teeth become aligned, so they move a bit more outward, but they also move sideways to ensure the upper and lower teeth fit together properly, so that chewing works correctly. In the animation, you can see some numbers where just a bit of the contact points are reduced without damaging the tooth, because the teeth are very tightly packed together and need to be able to move and shift in order to align. You can see that with alignment, each tooth fits with the one above it to ensure the proper bite. The lower left canine is all the way forward and down. It gets straightened and brought into contact with the canine in the upper arch, because the canine acts, let's say, as a guide during lateral movements. Every time we chew, we're talking about guidance. They need to go too. Let's say it's mainly the canines that guide the movements, so we've also established proper contact. And finally, the upper arch. The upper arch, as you can see, is very contracted, with the upper teeth a bit more outward. Within anatomical limits, the sides are widened a little and it is aligned. It is actually given a U shape. Before it had a triangular or V shape. Now it is given a horseshoe shape. And these again are the alignments. You can see the red beads you see in the animation are composite beads, which are then attached to the teeth. So they are white-red. They appear in the simulation because I am the one, in this case, who has to place them and carefully check where they are positioned. At the end of everything, you can also see that the shade is a color, a bit more a strong yellow. We want, in addition to giving the correct shape, to also give the correct shade. Usually this is done at the end of the treatment, but some prefer to do it earlier or even during the treatment. And with Dr. Mishenzi, who is our dental hygienist and takes care of teeth whitening, a home whitening treatment was performed using a whitening gel to be applied inside the transparent trays. And you can see, within a few weeks, how the shade of the tooth has changed. After changing the shade of the tooth, the shape of the upper right and left lateral incisors was also changed. In this case, you can only see the right one. As an illustrative image, you can see that the space has been opened and aligned. The lateral incisor was about the size of a grain of rice and it was given the correct shape. It was enlarged with composite resins in the same color as the tooth after the whitening. In this way, we performed a cosmetic restoration in every sense, using the same shade of white as the tooth. And the tooth is neither damaged nor worn down. Final occlusion, right, front and left. Notice the alignment, the way the teeth fit together for chewing. How do the teeth close properly on the right and left sides? And in the front, we achieve both the correct contact and a proper smile with straight teeth. And the extrodal smile benefits from it as well. The upper arch was very narrow and contracted before. Afterwards, it's much wider because the teeth have been straightened. Before, they were all crowded together. Inside, the teeth are straightened, and you can also see how the lateral incisors have been enlarged, and the correct proportion between the teeth is achieved. These are our contact details. If you have any questions, feel free to write to us or call us at this address. Give the video a like if you found it helpful. I'll say goodbye now and wish you a good day.